Welcome everyone to our webinar today, Lights, Camera, Community Action, Models, Theories, and Frameworks for Mobilizing Community Partners in Community-Based Adult Injury Prevention, a Scoping Review. This webinar is presented by the Falls Prevention Community of Practice, sponsored by the Ontario Neurotrauma Foundation. The webinar technology is provided by the Seniors Health Knowledge Network. My name is Lindsay Toth, and I am a project coordinator at the Ontario Neurotrauma Foundation, or ONF. Ellen Gagné also joins us on the line. She is a program director at ONF and will be assisting with the webinar technology. Before we begin, I'm going to give you a quick rundown on the Level 3 web meeting system. This webinar technology consists of two parts. The audio is provided through a telephone conference line. The visuals are provided through a web platform. The phone number for the conference line and the link for the web platform were sent to you by email after you registered for the webinar with Level 3. If you have questions about the technology at any time during this presentation, please type them into the chat box located on the left-hand side of your screen. Alternatively, you can send me an email to lindsay@onf.org. I will work with you to resolve technical issues as soon as possible. This webinar will contain opportunities for participation. There will be online polls which you answer right on your screen, and a question and answer period at the end. If you have topic-related questions during the presentation, please type them into the chat box. During the Q&A, I will read those questions aloud to the presenter. If you would prefer to ask your questions over the phone, you may unmute your line when prompted with the directions. This webinar is being recorded. The recording and the slide deck will be distributed by email after the webinar. I would now like to introduce our presenter for today, Rochelle Parcells. Rochelle is a Level 2 health promoter with the Brant County Health Unit. Rochelle joined the Falls Prevention LDCP as a knowledge user in August of 2016. She contributes by providing an evidence-informed perspective on what knowledge users may be looking for during the various stages of the project. So I'll now hand it over to our presenter. Rochelle, you can unmute your line by dialing *7.
You can do what,
Rochelle, are you there? So it's *7 on your telephone keypad to unmute your line.
Not you.
All right, Rochelle, I'm going to unmute you manually. So you should be unmuted now. Can you hear me?
Hello?
Hi, there we go.
Hi! My keypad didn't want to cooperate. Sorry, guys.
That's okay. So you can feel free to take it away anytime.
Okay, so good afternoon to everybody who is on the line. As they said, my name is Rochelle, and I'm going to be presenting on all the work that this community of practice and LDCP has been working on right now. So the presentation is a little bit preliminary. The report is being finalized at the moment, so this is what we have found. So a few housekeeping items to begin is the table of contents. So essentially, the rundown for the presentation today will be discussing some objectives. I'll discuss the process and the project itself, the findings, which is the most important part to everybody today, some key lessons that we discovered along the way, and with any good research project, you must state your limitations. And of course, I have to let you know who the dream team was who've been working on this for the past year and a bit. And finally, we'll have a question and answer portion. So, some acknowledgements. The Falls LDCP team would like to thank Public Health Ontario for its support of this project. The team gratefully acknowledges funding received from PHU through the locally driven collaborative project program. The views expressed in this publication are the views of the project team and do not necessarily reflect those of Public Health Ontario. That's legal stuff we have to go through. So the objectives. So today, if I do my job correctly, I will be sharing the findings of our project, and as with any good scoping review, which is essentially what we did, the last step is to consult with key stakeholders in regards to knowledge transfer and exchange, which is kind of the purpose of this webinar. So I need everybody on the line today to let me know, how is it you like to receive information or research? It will be a poll question at the end, but I want you to think about it as I go through the presentation today. So if you would like to receive our scoping review manuscript and read 40 pages, we will absolutely deliver that to you. But if there are any other ways that you prefer to receive information, so a video or infographic, anything that you've received in the past that you enjoy reading or receiving information, any other mediums you can think about those and share them towards the end of the presentation. So how did we all get started? So between 2005 and 2013, falls across the lifespan nationally hasn't really been decreasing, which isn't a good thing. And preventing falls, especially among older adults, is really important and really complex. So it tends to involve a lot of collaboration and working together, because there's multiple agencies that work on the different aspects of falls prevention and the different tenets that can lead to a fall. Local public health units are responsible for working with community groups to kind of reduce injuries from falls, and it's one of the tenets in the Ontario Public Health Standards. But in my experience and a lot of other people's experiences who work in public health, a lot of times the local public health units tend to be the drivers for any kind of community action or community groups or coalitions, and that's great. That's fantastic, thumbs up. But sometimes with the nature of public health, there can be turnover and change that can negatively impact the initiatives that happen within the community. So community mobilization is one of those terms that essentially allows us to use the capacity within the community to bring about change by joining together all the strengths of the community. So public health can be more of a supporting role, so that if things change within the public health sector, it doesn't negatively impact all the work that's being done in the community, or it doesn't, it's not a drawback. So that was kind of how the project started, is okay, how do we address this issue? And community mobilization was kind of the answer. But when we looked to the literature to try and find any kind of evidence or guidance as to how to do this, it kind of failed us, I'm not going to lie. So there's not a lot of evidence as to the meat and potatoes of A, B, C, D, how do you get to this endpoint. So the group decided that a scoping review would be the best way to try and gather all the information and formalize and synthesize it to try and answer that question of how do you get there. So the purpose of the project really was to identify the various approaches, if they're out there, in regards to community mobilization for health promotion and falls prevention issues amongst senior populations. That's the framework we're kind of sticking to. And at the end of it, we're hoping that we do have recommendations as to which approaches may work best and can be applicable and transferable to work within Ontario Public Health Units. Because finding information is great, but it needs to be able to work for us in our different capacities. So before I begin moving into the scoping review process, we have a quick poll question just to see what everyone's level of knowledge is in regard to scoping reviews. So it should pop up on your screen now, and you guys can go ahead and answer the questions. It's pretty much just how familiar are you with scoping reviews? Most people have heard of them, and now a lot of people know nothing, which was me at one point. Don't worry. Oh, only 3 people would know how to write one. Well, I am proud of you for that. Okay, so it's actually kind of a tie between some people know nothing, and some people have at least heard of them, which is fantastic. So a quick overview of scoping reviews. This is not as scary as it looks. Essentially, we start with identifying a bunch of research and articles from every walk of life. And we when you're doing a scoping review, utilize a librarian. They are fantastic at finding all this information, so you don't have to stress yourself out doing it. So we had a wonderful librarian who searched through various databases and looked for academic research as well as gray literature research, so non-academic research. And then we also went through and looked for more articles by hand and looking through the references of all the research as well. And in the end, after doing all of that work, we came up with over 13,000 articles that talk about community mobilization. Now, nobody has time to read 13,000 articles, so we had to apply certain criteria that allow us to weed out what wasn't actually applicable. So maybe it didn't have a falls prevention context, or it wasn't within our geographic area of interest. If it's not in English, we totally weeded it out. If it was published before the year 2000, it was gone. If it doesn't have any kind of framework around it or no theories that we could use, it got cut out of the pack. And we weeded that down to about 250 articles, and then we decided we're going to read the abstracts, which is like an executive summary or a brief synopsis for those who aren't aware, of what the actual paper is about. And from that, we actually weeded out 241 which did not apply or work. And we ended up with 10, which is much more manageable to synthesize and gather information from. So in the end, this was the criteria we used to get to that 10. And it was really important that community mobilization was referred to either in the title or the abstract or the executive summary. It had to have a health promotion or injury prevention context. It needed to be mentioned somewhere. And most of all, it had to describe one community mobilization approach, because the whole point of this is the how, finding out ways of getting to community mobilization to work. So it was really, really important that that was mentioned. And in the end, this is what we ended up finding. So here is your dream team of theories, models, and frameworks for community mobilization. We found 10, and out of the 10, some of these were mentioned in multiple articles. Some have theories, some have frameworks, some have both. Some of them, such as the Community Coalition Action Theory, this one, yes. This one, some of them have been reviewed and evaluated. Some have not. Some have had pieces that have been evaluated for its effectiveness. This one, unfortunately, was evaluated and it was deemed unsuccessful in the context that it was used. Others are in the process of being evaluated. So I think the one by... Sorry, I'm just double checking something. So the conceptual, yes, this one has had pieces evaluated. Some of them include a public health framework or a public health context, which is really, really good. And some do not. Some are more generic. So I'm going to go through an example with you so you can see how one of them could be applied and how one of them could be utilized for community mobilization. But before we do that, we're going to take a quick, no, actually the poll is next. So just a quick, sorry, there we go, slide wasn't advancing. So a quick synopsis of the findings, 6 models, 2 theories, and 6 frameworks. So within that 10, there some are models, some are theories, some are frameworks, and some are a combination of both. As I said before, only one model has been evaluated and it was deemed unsuccessful. 5 of the articles are published in a generic context, which means that they're not really specific to falls prevention, but they could be used in falls prevention and as well, or they could be used in general with other the word is escaping me, but like in child health or in sexual health or in VPD. So if you're trying to do any kind of community mobilization with other programming, that is the word, with other programming in public health, it could also be used there. one article did attempt to implement a falls prevention model, but it was considered, because that model didn't consider the local context, and also it had ineffective decision-making processes. So it wasn't really appropriate to promote certain tenets of falls prevention. So like physical activity is really important. It didn't work well to promote that. So they're very different, and they can be used in multiple ways. But a quick question to everybody. Of the ones that I have shown you before, so if we go back to this slide of these, has anybody ever seen, heard, used them before? I know when I first encountered them, it was my first time. So quick poll just to see if anyone has utilized them in the past. Just get the poll up. Oh, we have a couple yeses. I expected everybody to say no, to be honest. Oh, wow. Okay, so as I expected, most of you have said no, you have not heard, touched, or seen them before. But a small percentage, 11 of you, have actually worked with them before, which is actually really interesting. So you can put this in the chat box, but for those who have, do you mind putting in the ones that you have actually encountered before? And also, are there any other frameworks that may not be in here that you have seen or used before that maybe we did not capture because they're older than year 2000, so they weren't included, for example? You can put it in the chat box as I continue the presentation, just so that we can see what is happening within the field. And I'll continue the presentation, and then we can discuss it later on during the Q&A section. So next, I'm going to go over one of the models or frameworks with you so that you guys can get a idea of how it works. Unfortunately, I don't have time to go through all of them, but I figure going through one of them would give you a good foundation as to how it may be used, or an example of how it should be used, and some of the outcomes that are present when using them. So the Mobilizing for Action Through Community Planning model, aka MAP, is essentially a community-wide strategic planning tool that aims to improve public health and helps communities prioritize the various issues in public health. It's really good at identifying resources and also helps taking action. So essentially, this is like the artistic view of the model. So you start by organizing for success and developing partnerships. You develop your vision, and you go through various steps to kind of get to this beautiful sunshine of a healthier community. And the more traditional view of the model is that it goes through 6 phases. These are your phases on the left-hand side. And you really do have to start by organizing, as with anything. You start by organizing, and you have your whichever agencies, key players, major stakeholders that are to come to the table that are really important, that's where you begin. So, and you work on your partnership development. So public health could be there, primary health care could be there, incontinence care could be there, vision, chiropractor. It could be also non-medical services, so services that simply deal with the social determinants of health or other determinants of health. And even community members that are just like your key champions and are actively involved in what they want their community to look like and to be, and what they expect from their community and what they're paying taxes for. All those people need to be at the table. And then you have to develop your vision, right? So vision is your second phase. And your vision is, what is your end goal? What is the long-term goal? What do you want your community to look like at the end of this entire process, right? Then you go through your assessments. So before you can figure out you have to figure out what's wrong, what's working, and what needs to change. So here, go straight across to this little circle, and these are your assessments. And you have to figure out what are your strengths, so what's important to your community, what perceptions about your quality of life do you have, what assets do you have, which is really important. You got to figure out what is up with your public health system. So what is your capacity? What are your competencies? What are you currently doing? Once you know that, you can move on to assessing your community health status. So what does your health actually look like? Are you guys all living to 82 because you're super active, you eat healthy, and you drink lots of water? Or do you have certain barriers that prevent people from getting to that optimal point of health? How healthy are your residents, and what is it they're struggling with that you need to work on to get to that end goal? And last but not least, you have your forces of change assessment. So essentially, what is happening that could screw this up, that could get in your way? If it's recurring, what could occur? So any kind of risks. This is like your risk mitigation piece. And what risks, not only to the community, but what are the risks within the health unit that could impact that, and risks within the different organizations or different parties that are at the table that could impact you guys getting to the end point. So once you figure out all of this stuff, then you go back here. You got to create some strategies. Figure out what themes need to be addressed to achieve your vision. You got to create some goals. This sounds very public healthy, right? And you have to idea your goals and strategies to implement. So this is all about implementation. And then you go through the action cycle. So when you implement, you evaluate, you plan, you implement, you evaluate, and you keep doing that till you get to your end point. So that is really how this would work, and it's very community-based. Like, it's not public health who's the one pushing this. Everything is done by, with, and for the community. So that's, with that framework in mind, it changes the way that you look at problems. It changes the way you address problems, because you go from, like, I know that in public health we do a lot of operational planning. With this model, you move to more strategic planning. There's a heavy focus on the agency, what the agency can do, and that is there. But with this model, you focus on the community and the entirety of the public health system. It's very holistic is the vision that they have. I know in public health you do a lot of needs assessments. Here, they try to emphasize assets and resources more so. There's a much broader definition of health, and it's not, I know that it's seen that because of public health, it's like with doctors when they wear the white coat, it's like they have this credibility, and public health has this credibility, but everybody knows something with this model. So even the retired grandfather of 6 who is chilling on his porch reading a book every day, he knows something, and he has something to contribute if he wants to be actively engaged. So there's something for everybody. And with this model, some of the outcomes that tend to arise are alliances and task force that tend to be stronger without that foundation of a public health person sitting at the table. There tends to be some examples of ones in past are people have seen increased grant funding and more targeted interventions, even more so than we already have, which is hard to fathom, but is true, and also more leveraging of certain faculties and facilities. So that is kind of one quick rundown of one of the models and how it works and what they're trying to do, or what the model aims to do, and what the outcomes kind of should be like. And there are other models within this scoping review. So, and each have their strengths and weaknesses, and they all have something kind of to offer. It's very context specific. So what will work in Brant County as a model won't work in Temiskaming, which is where I used to work. It won't work in Waterloo. It won't work in Toronto. So depending on the context and what you're trying to address and your barriers, each model can offer something different. So quickly I'm going to go, well not quickly, but I'm going to go over some of the key lessons that we learned while conducting this. And one thing that we noticed is that mobilizing partners is really important for larger interventions in injury prevention, for quality improvement, and for intervention mapping. So for trying to map out where you'd like to go, you can't do it really well without bringing everybody in the table and making sure that everyone who's at the table is diverse. Don't solely bring a very medicalized approach or a very health approach. There's, as I've with the other models, people have things to offer, and you'd be surprised what you can learn when you develop untraditional partnerships. That's a real key action area. That's really important. As well, the models are really good at encouraging partners to work together once they're mobilized. There wasn't a lot of attention spent on how do you get the partners at the table, because once they're there and they're mobilized, that's great. But sometimes you got to pull teeth to even get them there, or you've got to convince them to come, and it has to be a very strategic convincing plan of sorts. So there wasn't much attention paid on, okay, here are some strategies to get people who may not see the value or see the time in it. Here's some strategies to get them there so that they can see it and want to show up. Also, there wasn't a lot of attention paid to, once you get people there and they're mobilized, great, but how do you combat fatigue? How do you combat making sure that people are continuously engaged? Because some projects take years, and in public health, it takes a long time to get things done and to see results, because we're working on these long-term goals that are, honestly, they're just large. They're large, and it is a population level thing, and change at population level takes years, okay? So making sure that people don't get tired or don't get fatigued and keep interested and see the importance even when, because you have lulls, like in life, you have highs and lows and lulls. So there wasn't a lot of attention paid to that. So that piece is really what we saw was missing, and I guess a future research project could be to look at those pieces that are missing. And we also noticed that there's a scarcity of literature kind of documenting processes and outcome evaluations from the use of the models, especially in regards to injury prevention and addressing larger communities. So there needs to be more added to the body of literature in terms of evaluating the models. As I said previously, only one model really has been thoroughly evaluated, and it didn't do too well. And then other models, certain pieces are being evaluated, which is nice, but the entirety might be nicer. So there's that piece is missing, kind of. So some limitations as a result. Some limitations, there's not a lot of Canadian literature. A lot of the stuff we found comes from the US. It comes from Australia, and I mean, you got to work with what you have, but we need some more Canadian literature. And a part of this project in terms of the next steps is trying to figure out if these models are applicable and transferable to public health units. So this is a big ask, but we're hoping that now that you are aware of the models and frameworks, and once we finalize all the tenets of the report and create a much more enjoyable way of disseminating the results beyond just sending you the report, that you will take it and see which one you can apply within your public health units and then evaluate them. And then we can take the evaluations and add to that body of literature and create something for people to get that Canadian context and to see how they actually work and what doesn't work about them, and see how they actually help in a Canadian perspective and a Canadian standpoint. The models, theories, and frameworks they can be used outside of injury prevention, so in other facets of public health or health in general. If you're trying to address the different program areas, it's quite possible that they can be applied. Of course, there is a limitation in terms of the experience within the team who's been conducting this scoping review, simply because we range in age from super young to much more seasoned. So, and it doesn't mean that all of us are super experienced with scoping reviews. There are public health practitioners, there are academics who are on the team, and everything in between. So that, since we are not the be-all and end-all, that is always a limitation. And based on our inclusion criteria, we did exclude what could be relevant models and theories, especially if they were published before year 2000. We didn't look at them. So there could be more. There could be a lot more, right? So that's a limitation. Now, another poll question for you. based on the information that I provided in the last 30 minutes, I know it's quick, do you see any of these frameworks potentially supporting your work? You can totally answer in the chat box. If you do, I know this is the big ask, but off the top of your head, could you see how? And if not, what do you see, or what do you feel is missing when it comes to support for you, the people who work in this field every day, in terms of mobilizing communities? I will go back to the frameworks again to show you what we found. I did see in the chat box that there are individuals who have interacted with the logic model for community-based injury prevention before, which is fantastic. And that is, based on the title, it is injury prevention related. But there are other ones that that could be utilized. And I know that there are some challenges, as one participant has indicated, time and money is always a challenge. I mean, not only in work, but simply in life. But I mean, that's also one of the reasons why it works well to come together with different stakeholders or people in the community, because that way you can share the burden of time and money. In theory, you should be able to share the burden of time and money. That's why you work together, so that it's not, the onus isn't solely on one person or one organization to be the driver. So that is why. But another quick, while you guys are thinking about that, I'm going to ask you to think about something else. And the question that I asked you before, in terms of what is the best way to communicate research findings to you, that would be great if you could also think about that and put it in the chat box as well. And let us know, I mean, if you'd like to see a Hollywood movie. We don't have the budget for that, but I'm sure we can scale it down to something more pleasurable that also is kind of in movie format. So this would be, now that we're coming towards the end of the presentation and getting into the question and answer period, it would be great if you could let us know what has worked for you in the past and what hasn't, so that way we can try and get that information out to you in the most effective means possible, so that you can read and figure out what all the different frameworks are. I know that based on the time frame, we weren't able to tell you everything about what the different frameworks are and how they work. But the next round of presentations will be able to do that. This was just to kind of get everyone's feet wet and to figure out how is it you'd actually like to receive that, and how is it that would work best for you. So before we get to the question and answer period, I have to let you know who are the individuals who been working together for the past year and a bit on this. And this is the dream team, a variety of individuals from a variety of places with a variety of backgrounds who have come together and just worked quite seamlessly on this project. So a special thank you to all those on the screen. And for anybody who's interested in actually joining the team, it's still possible. There will be another phase to this project. This is kind of just phase one. And if you'd like to join the team, especially if you'd like to be responsible for administering the funds for the next phase of the project, make sure that you contact me at the end of this presentation. I will put my email in the chat box so that everybody has the ability to see it. And you can email me and let me know if you'd be interested in just the next phase of the project and anything like that. And of course, now it's time to answer all your questions.
All right. Thank you so much, Rochelle. So we do have a number of questions that have come in through the chat box already. So maybe we'll just start there, and then we can open up the telephone lines if anyone would like to ask a question over the phone as well. So from Jessica, how long did the whole scoping review process take to complete, from the beginning of the literature gathering to the 10 articles that you've now finalized?
So from when we started gathering to when we finalized the 10, I think it's been like a year. I'm going to say it's been a year. It was a very tedious process, and it was very time consuming, just because of we were very detail oriented in terms of going through all the different articles that we found. We even went through the references of articles that we found and hand searched things, and we had to come to consensus about what to include, and it was a group consensus. It wasn't like 3 people. It was like 7 people had to figure out which ones were to be included and which ones weren't. So there was a working group that worked specifically on that. We had to break into working groups to work on different aspects of the project, but everybody was privy to it at all times. But I would say, probably a year to get down to the final 10, because I joined the project in August, late September, and the project had began, I think, in the beginning of January or late December of 2014, because we're now in 2017. Yes. So I would say it took about a year. That part is the most tedious, and then once you have all that information, writing is much faster and easier because you've already synthesized all your stuff. And the project's supposed to schedule to end, at least this phase, by the middle of this year, and then we move into phase 2.
Fantastic. All right. You were speaking earlier about ways to get people to come to the table, and there's a comment from Wendy about that. Coming to the table is only one way. Being on a committee is only one way in which people can be a partner. What did the research say about engagement not being equal to just being on a committee?
What did it say about engagement not being equal to being on a committee?
Like, are there ways to engage people without requiring their attendance at meetings and on committees?
There are ways, but as I said in my limitations, this scope review didn't really cover how to get them there. It covered what to do once they are there. And that's one of the limitations of the study, is that it was great at telling you, okay, so you can get once people are there, this is how you keep them engaged, and you can use this framework or this theory or whatnot, because different theories were applied, which I should have mentioned some of them. But theories that tend to be prevalent, or that I've seen at least multiple times in public health, so diffusion of innovation, social cognitive theory, and those are kind of some of the bases for some of the frameworks. But it did not talk about how do we get them there beyond just trying to entice them to come sit at the table and participate in the various meetings or the different way, whether it be teleconference or whatnot. I know that one thing that I've noticed is that they have to see value in it, and once they see value in it, you can get them there, and there are different ways. But because this scoping review didn't specifically look at that, that's a question that I can get back to you on if you would like me to.
Maybe a topic for a future webinar.
Yes.
All right. Another question from the chat box. Were there qualitative research studies, case studies, and stories about what has worked to mobilize people in groups?
I think so, yes. There were a few. Some of the papers did have actual examples that they provided, like very specific. So they talked about like one example and went through how specifically the framework was implemented and utilized, and that is mentioned in the paper itself. I just was told I wouldn't have time to go through all of that today, so that's why it wasn't included. But yes, there are some specific case studies and stories about certain frameworks that had an example as to like when it was used and when it wasn't. There was one framework that was used on a football program in Australia called Footy First, and they went through everything in like super detailed content to show you how it was used. There was one framework by Downey. And it is the Theory of Coalitions framework, and their example used rural communities in the U.S., and it was the Community Coalition Action Theory, and how they did community coalitions in those rural areas, which had multi-sector and multi-level actions to prevent injury in all ages, and looking at different tenets of it. And public health, as I said, was integral to it, but there were other issues in it that they highlighted, things that they missed and wanted to address, but they gave you how the outcomes and what relationship and the different processes that were involved. So there are definitely specific examples with some of the frameworks which are highlighted in the manuscript. So that definitely is going to be something we'd like to include in the next section of in terms of figuring, in terms of dissemination. So if we do end up doing a video, if that's what people like the most, or if we end up doing an infographic, or whatever the case is, highlighting some specific examples so people can see it, because it's great in the abstract, but if I tell you what, that's great, but if I tell you how and why, I think that's better. So that will be the next step. But we wanted to start and let you know that what's going on so that we can figure out how is it you like it, and then we'll give a more detailed description in addition to the manuscript in case you don't have time to read the manuscript or whatnot.
Fantastic. Another question in the chat box from Barb. I work in an ambulatory oncology setting and not public health, but I am thinking that map could be adapted down to the community of the organization.
Yes, absolutely. Not all. I spoke in public health simply because of the context in which this was done and the context in which many of the different partners involved in this project work in. But as I said previously, 5 of the frameworks are very generic. They're not public health related. They're not injury prevention related. So they can be applied to other pieces. So it can be applied to more community projects. It can be applied if the community would like to work together to work on a different issue, teen pregnancy or something. And it's not solely public health related. I'm sorry if my examples are. It can be adapted so that they can be utilized for that purpose. So it's not, I know I use the public health context, but there are others that can be used that way. The conceptual models of partnerships for health improvement was really just about population health. It wasn't necessarily a public health setting. The logic model for injury-based prevention program is solely injury prevention. It's not like, yes, that is public healthy, but it could be injury prevention just in general, and it doesn't necessarily have to be falls prevention or childhood falls prevention, that kind of stuff. There's a lot that talked about sports-related injuries. And there was one, the Community Coalition Action Theory, that's really about healthy communities. And think healthy communities in the broad sense, not solely just public health, but having a healthier community and getting to that point and addressing whatever issue you have. So it can be applied in many different ways, so don't worry about that.
All right, question from Karen. She was wondering if your list of papers that you reviewed is available for us today, or if you have anything available for us to look at today.
I can provide the list. You know what? That's really funny because when I originally did this PowerPoint, I had the list of papers in it, and I was told that it was too much to look at. So I took it out and made it simpler and just listed the actual frameworks. But yes, I absolutely have the list. I can, when they're sending out the slides or the recording, I can make it an attachment so that you can see the list of papers that we included with the different, and it will tell you what country they're from, the type of design, the setting, the model theory or framework, which is kind of what I discussed today, and whether or not it's been evaluated. So I can absolutely provide that so you can have it to look at if you'd like to look more in depth into this on your own.
That's fantastic. All right, we have another question in the chat box. They just keep coming. This one's from Josephine. I'm from a province outside of Ontario. Are there any other provinces involved in this project?
No. That's
Is there the opportunity?
I will never say no to more people wanting to be involved. Absolutely. It is just an Ontario project simply because the funders are Public Health Ontario. But if you would like to be involved, I'm sure that is a discussion we can have. I'm very persuasive. And but I definitely think it would be great to have another perspective as to, because I'm sure other provinces have things that they have similar issues and they'd like to figure out ways to mobilize their communities as well. So absolutely, Josephine, we can be in contact and we can discuss more how this can be an assistance to you in your province.
Perfect. And just remember, Rochelle has put her email address in the chat box. So if you want to send her an email or you want to get in touch about opportunities to collaborate, make sure you do copy and paste that email address out of the chat box before we end the webinar, because it won't be available to you after. We will circulate her email address again once we send out the slides and recording, but that might not be for up to a week. So if you want to get in touch sooner rather than later, make sure you do jot that down now.
And also, Josephine, I just remembered that one of our partners who's involved in this, he started in Ontario, now he's in Saskatchewan, and he's still working on it. So if he's in, I can get you in. Don't worry.
There we go. So there are some more opportunities.
Mm-hmm.
All right, I'm going to give an opportunity now. If anyone would like to ask their question over the phone, sometimes it's just a little easier to speak than to type out a big answer. So if you want to unmute your line by dialing *7 on your telephone keypad, please feel free. Go ahead and just start talking. I'm also thinking, we still do have some more time for discussion, so we could also go back and revisit some of your sort of open-ended poll questions, Rochelle, if you want to have a bit more discussion about those. But if anyone wants to unmute, *7 is your time.
Copy of the presentation, yes, will be available. Sorry, guys, I'm just going through the poll.
Hello.
Hi.
Hi. My name's Pat, and I'm in Sudbury, Ontario. And none of the people there look as if they, people that were involved in this at the beginning are from the Northeast. And I just wanted to let you know that the Northeast LHIN and the Sudbury District Health Unit, along with, I think now we've got North Bay, Timiskaming, a few others too around, are really making a big effort with a couple of projects to help people, particularly seniors, to prevent their falls. We have the Stand Up program, which runs and has become extremely popular throughout the area, and it's run by in different spaces by basically volunteers. I think they get some transportation paid. And we also have the Sudbury Rising Stars, and that's the group that I'm involved in. I am just a senior, okay? I've never been in the public health area at all, but I wanted to be a part of this because I figured that this is a group of, we are a group of not actors, we're a group of seniors who perform skits to other seniors, to schools, to gerontology students, to anybody, you name it, and they all get something from it. And we have about 8 different skits on falls in particular, plus we have other health issues that we have been asked to promote. So we have in total about 25 skits that we put together, and depending on the group that we're going to. And that has become extremely popular. So I just wanted to let you know that there is something out there. I know it's not where you're at, but it's the next step down, how to get it out into the public.
Okay, that's fantastic. I am aware of the Rising Stars troupe. I did actually used to work in Northern Ontario for a little bit, and the Rising Stars troupe and the seniors community up there is fantastic. We have a champion up there who is fantastic and who does a lot of work in that area. So I am aware that that is a super popular thing that happens up there. I haven't seen it since I've moved down south. I haven't seen it down south yet, which was surprising to me. But
did you know it started down there?
really?
The person that started was very involved in the loop right at the beginning, was one of the first people involved in it. So there is somebody that can be located and checked on. I've forgotten her name, I'm afraid, but she was at a convention up in Sudbury that I attended, and we were in the booth next to each other, and she spoke about it at that time.
Yes, it's Marguerite Thomas, who is the coordinator of the Fall Prevention Community of Practice, and I know she's on the line today. So Marguerite, would you like to unmute your line by dialing?
She just said, "Tell Pat that that's me."
Great. Hi, Marguerite.
Okay. So then doing the Rising Stars troops, when you go to different areas to present your different skits on falls, do you find that entices individuals to join or to get more involved and be more active in the different efforts to prevent falls across the community?
I'm not 100% sure on that. It is something that we could ask, and we do get people to come and join us from the odd one. But it's quite a daring thing for some people to do, to think that they are going to be performing. But we make it such fun that they do come and join. I have about 25 people that I can call on to perform, and we usually do 6 or 7 skits in an hour in different places. And we were at the Alzheimer group the other day, and oh my goodness, they were up and dancing and with us and everything. It was just amazing. Schools. Yeah, but we tell them to take the messages home when we go to schools to their grandparents and to talk to them about it and to show them the kinds of things. Children are very, very interested in this kind of thing. Grades 3 to 6 was one school in particular that we had 150 kids, and boy, they enjoyed it. Gerontology students up at Laurentian University, we were with them for 2.5 hours answering questions afterwards, and they were just thrilled, and they said, when we get out there, we're going to have you come and perform for the different groups for us, kind of thing. So I guess that's the way we do it. We do advertise, if you know anybody and they want us to perform, we'll come and do it, and that kind of thing. We talk about the stand-up program too, because some of our members actually do that as well, and that is so popular. My goodness, they're running a number of, they go twice a week for an hour at a time, so that's 2 hours a week, and it's a special program. I actually took it so I know what I was talking about, and it's dealing with getting your toes moving so that it helps you stay on your feet a lot more easily and being able to do things. We've had people go from where they were walking with walkers, coming in and shuffling with walkers. I've watched them come in and grow in the classes throughout the weeks that they are there, and feel very confident about walking around in the room without their walkers. So it is quite an amazing. We've got 2 different programs that are really very good.
That's fantastic. It sounds like a lot of knowledge dissemination and just informing people of the different ways. So it's very knowledge generating, which is fantastic.
Yep.
Marguerite just said she will email you, Bet. And quick correction. I had said, Jessica Liu had asked how long did it take. I had said we started in January. My colleague just corrected me. We started in summer. I don't know where I got January from. I think it's been so intense. It just feels like it's been an extra 6 months. But really, she said it's been since the summer. But I came onto the project late, and I think I just got dates mixed up because we have some dates that targets we have to hit, and I know that some of them said January, but I think it was January 2017, and I was thinking 2016. So really, it's been a 6-month process to this point, and now the report is almost finished. The next step, of course, is taking all your feedback in terms of how you would like to receive the information, doing it like that, and attaching the report or the manuscript, to it so that you have both. But all the data was screened in summer, and the working group worked super hard to get all of that out. So it did not take that long, Jessica. I'm sorry. It just feels that way because it was a lot of work. But yes. Are there any other questions, comments, concerns? I've seen that people seem to like an infographic. You guys really like, I like pictures too, so I can't lie. They're quick and easy, and it's kind of like a pretty study note, which I was really good at in school. So seems like an infographic is the way to go. Someone said an electronic YouTube video, which is something we were thinking about, making like an animation kind of thing and explaining it through images, because I mean, words are great, but you guys will remember it more if you watch it. You guys remember movies. Well, actually, no, I remember books, but anyways. But yeah, that seems to be the winner so far. So infographic. Good to know. Thank you, guys.
And if you have any thoughts after the webinar, please feel free. You can contact Rochelle afterwards with more ideas or comments or requests for information. So I think with that, it seems like we've answered all the questions there are. So that's fantastic. Thank you so much, Rochelle, and thank you to all of our participants today. So I'm going to just ask that you please do not close this window just yet. Wait until you've been redirected to the Level 3 lobby screen. Once you see that screen, then it's safe to close the window, and a very brief evaluation survey will launch in your web browser. We'd really appreciate it if you could take just a few moments to give us some feedback so we can continue to provide these high-quality webinars. As I mentioned earlier, a recording of this webinar will be posted to our YouTube channel and circulated to all the participants in the coming week or so, along with the PDF slide deck. Feel free to pass it on to any colleagues who you think might be interested. For more information about the Fall Prevention Community of Practice, you can check out Loop, which is our online communication platform, at fallsloop.com or shootloop.com en français. All right, thank you very much, everyone. Have a wonderful day.
Bye, guys.